Welcome to our ongoing conversation with communication exemplars. We moved through the course to the point now that we're dealing with the challenges related to technology and communication. And to really bring it to life, we've moved the conversation into the environment of healthcare. And today we've invited Dr. Dave Butler from Sutter Health to come in and share a little bit about the challenges of technology in trying to make us all healthy and better. So let's start with what is it that your role is in Sutter, and how do you justify this minuscule paycheck that they give you?
Well, it is minuscule.
Right.
My role will be described. My formal role is the vice president for Sutter EHR optimization and transformation.
Okay.
And that's the formal title. What that really means is that I am the company has identified that we are implementing a lot of technology across all of our providers, and that we will now need to advance we'll now need an expert that understands how the interaction of technology and physicians as it provides the care, as well as care teams, nurses, ancillary staff, and those folks. So my job is to make sure the investments that we've made in this large electronic health record is maximized.
And just what is an electronic health record? As we talked before, that our students tend to be under 30 and bulletproof, so they've stayed out of healthcare. So just what is an EHR and what does it do?
It is interesting you say that, because most under 30 are folks like, haven't it always been electronic? I mean, so it's like, why is this a thing, right? Yeah. And at least my daughter would say that. It's like, is that a thing? What do you do, Dad? You know? And I believe that traditional healthcare has been you make an appointment with the physician's office, you go in the physician's office, the nurse will see you first, make notes about why you're there, the doctor then comes in and listens, talk to you, make notes while you're there, then if you need a prescription, they'll write a prescription, give it to you, you then take it to the pharmacy, get the medicine you need, and then you're better. And if you're not better, you then make a phone call to the doctor's office, things like that. Well, what we realized about that system is that there was a lot of touches, a lot of waste, a lot of handoffs, and things that we felt that an automated system would be much more robust at managing than those touches. So moving from all these paper-based transactions to a truly electronic health record that handles everything from your scheduling to the rooming of the patient to the vital signs to when the physician comes in, the documentation of your visit to the actual prescription of your medicine. You now will be able to, one click, it's at the pharmacy waiting on you. A lot of folks feel like, okay, that should have been that way in the first place, right? Why is that so novel? Right. And that's typically what the electronic health record will do, and that's kind of I call it paper to pixels. So we've gone from paper to pixels in healthcare finally, and that's a big deal in healthcare, unlike other industries that a lot of millennials or some of the younger generation interact with, such as banking and the airline industry, things like that. So,
but it's interesting, earlier on in the semester we talked about as a message moves through a channel and it moves from one level to another, it tends to get twisted and filtered and spun. So does the EHR kind of eliminate that, so there's more purity of what the physician is seeing and what's being recorded?
Exactly. That's exactly. So EHRs were implemented to assure patient safety. That's the number one reason that institutions choose to implement an electronic health record. When a physician uses this method to write a prescription for you, Jerry, you come in with a sinus infection, I'll give you a Z-Pak. There you go. Yeah. What I may not have known was that you had a bad reaction to Z-Pak. You may have known it as azithromycin, not Z-Pak, so it didn't flag you to say, doctor, I'm allergic. When I have to now enter that, now I have something called decision support. The computer can now assist me to protect you from those adverse effects. So that's at minimum, an electronic health record is just a copy of the paper record, but at its maximum, it's a fully integrated clinical decision support and analytics delivery engine that is there to protect the patient, as well as create efficient workflows, seamless for the doctor and nurse. When I order a medication, the nurse then immediately sees doctor's already ordered that medication, so she then can pull up education materials or other things that she can do, or he or she.
Unfortunately, I've had to visit some of your facilities on a horizontal, not a vertical basis, and I was always concerned that there seems to be a change of physicians per shift and a change of nursing staff per shift. Does this electronic system help with error reduction?
Exactly. So what we find is, so what we know in healthcare, Don Berwick came out, there's a group called the Institute of Medicine who studies healthcare in the United States. And a landmark paper came out in '99, 2001 called To Err is Human, where it highlighted that we in the United States, we hurt or harm or even kill patients at probably the rate of crashing 2 jumbo jets per day.
Wow.
And these are unintentional. It's not like, at Dave Butler, I'm the doctor, I see you, we do things, we take care of patients.
Sure.
But when the study came out, it was a really big revelation that healthcare had some opportunities. And the biggest opportunity it had was to start automating and adding foolproof ways to help the physician, nurse, and the patient to make sure that when you come in the hospital, that you leave out safer, so that we do no harm.
Right.
And so that's really what the genesis of the electronic health record is, and that's why there's a big impetus right now from the government and all sorts of insurance payers and things like that, does this hospital have an electronic health record that can assist the physician, nurses to protect the patients from harm? Where you have a band on your arm, we'll scan that, and then we'll scan it against the medication. If any kind of electronic flags come up, we know that's the wrong medicine. Historically, the nurses had something called the 5 rights. The 5 rights of medications: the right medicine, right dose, right person, things like that. All these manual processes, and now we've automated so that we can now have a higher statistical chance this medicine that we give you is for you. And medicines kill people. So it's a very, medications kill people, and sometimes as physicians we have been placed in positions, the history of healthcare is the order lies with Dave Butler.
Right.
I write 10 orders and I sign at the bottom, the nurse and then my care team executes those 10 orders. Hopefully they pick up some things that I may have missed or made a mistake, but if they don't, that error can propagate through and hurt patients.
Wow. So it really isn't artificial intelligence, it's more of a support system.
Exactly.
Excuse me. We talk about communication challenges in organizations. Here it puts it to a whole different perspective. The other piece that fascinates me is you seem to be a person that's always looking down the road. What do you see evolving in the realm of technology to help deliver better care?
You know what I see evolving, and this is one of those, when I put my doctor hat on, it kind of freaks me out a little bit, but when I take my doctor and put on my administrative hat, it's a bit exciting. And when I put on my patient hat, it's even more exciting, right? So I have to think about this in multiple ways in my schizophrenia working here, right? And
well, that's not always a bad thing.
I think it's a good thing. That's what my therapist says.
Right.
So, so what I see evolving are what you're seeing when you go online, when you go to Amazon.com. What happens when you go to Amazon.com? You order something, and the next screen below it says, other people like you also enjoyed these things. And other people like you also looked at these things. It gives you really logical recommendation based on your previous behavior or based on a population of people like you. So there's a term in medicine now called evidence-based medicine, meaning just because that azithromycin that I was talking about before treated your sinus infection 2 years ago, what we know, so just because that azithromycin treated your sinus infection 2 years ago, that doesn't necessarily mean that that's the latest treatment option today. And so how do we now disseminate to all of the physicians that may have always used azithromycin for 10 years, say, oh, this always works for me? Well, the question is, how do you know, doctor, that has worked? Because the patient didn't come back? Because they didn't call? Maybe the patient went to the emergency room. Maybe the person was hospitalized. Maybe they chose a different doctor because the medicine didn't work in 2 days. We didn't have good feedback mechanisms, so a lot of practice of medicine was what we depended on. And so now we have a bit more data. And so what I see coming down the road, Jerry, is a lot more of some of the augmented decision support tools where we expect this computer now to be able to look when a Jerry Essenson comes in with these symptoms, these 5 symptoms, it's going to run through a database of 200,000 patients with those exact symptoms and say, physician, would you think he may have one of these diagnoses here? That's a very big paradigm shift in healthcare.
So the machine's going to be electronically communicating with a pop-up window or something?
Or something of that
Yeah,
nature.
yeah.
It's gonna give us better and more statistically significant reasons that we need to think about another diagnosis that we may have missed as a human. Doctors are humans, remember, we don't have any special powers. Except for
Really?
Spock. Spock,
Oh, yeah,
Spock is Vulcan.
I gotta say, wait a minute.
Spock's
I-
Vulcan. Yeah.
You're
And
talking,
Doctor Who's the Time Lord. Doctor Who's the Time Lord and Spock's the Vulcan. Sorry, go ahead.
you have physicians that are trained to be kind of hands-on healers, and medicine, as I understand, has been taught pretty much the same way
Since
for a long
Hippocrates.
time. Now you're coming in saying, wait a minute, there's a different way to do this. What kind of barriers do you run into with the physician community when you're introducing new ways of communicating?
I'm the doctor, put my doctor hat on. I'm taking care of a patient with a computer, and the computer will pop up and tell me, hey, this patient is at risk of dying of sepsis, which is a bacterial infection in the blood that's caused your low blood pressure and actually the #1 cause of death in hospitals.
Sure,
But then when I've just examined the patient looked pretty good.
sure.
Okay, this computer is challenging me as a physician,
Right.
as a well-trained physician. And so that's one barrier, is the change management of having something to challenge you and all the training and the end sample of patients that you've seen over the years.
Sure.
That's a big deal. And so I think the pilots ultimately had to go through that first when said the autopilot,
Right.
we think can land this plane better in this type of weather.
Yeah,
Right, you know,
sure,
right?
sure.
And so I think a large part of this is going to be change management. It's going to make sure that the technology that we incorporate it the right way, that we augment and we supplant, that we augment the physician's knowledge and not necessarily try to supplant it or replace it, right? Electronic trains that don't need an engineer, right?
Sure.
We could do that now, that's there. But there's still a human factor to it that we have to respect.
Right.
Humans and technology right now, or we're at a really interesting crossroads. And I think we're at the adolescence of technology in healthcare. And I'm a pediatrician by training as well as an adult doctor. And what we know about adolescence is that's a tough period of your life. It's the goth,
Yeah,
you're not
yeah,
really
yeah.
sure where you are, what you want to be when you grow up. So I think that's where we are right now in healthcare and technology, because there are some primary care physicians that are really afraid that their livelihood can be threatened if this computer gets too good and starts matching their diagnostic acumen for certain diagnoses,
Sure.
right?
Yeah.
And then there's also some that are excited by it. We're doing some pilots now. It's sort of called Google Glass. We got the Google glasses
Yeah,
on,
yeah.
where we have a person in another room. They're listening to the exam. The doctor's talking to the patients. They're ordering things the doctor's saying. You know, listen to your lungs are clear. Okay, your right lungs sound a little bit like there's some wheezes. I think we'll give you some bronchodilators, albuterol, and that person over there, a human, is actually putting those things in. What if one day we just say albuterol 10 milligrams and automatically it does it like Siri?
Sure.
Those are the things that we will help the patient, but at the same time is going to change a bit of the paradigm of healthcare. And getting to the next level is, why do you need to come in and see the doctor at all? My daughter's in London now. We had a FaceTime call, and that call was pretty clear, crystal clear. I could see she was asking me about a pimple.
Yeah.
I said, Dad, do you think I need antibiotics? She just held the phone up. I was like, it looks like try this first and then go to the doctor. That was a doctor's visit. That's now no longer
Did you
the
bill
doctor.
her for that?
I didn't bill. You know what? I did subtract it from her stipend, her monthly stipend.
That's right.
So that's kind of where I see healthcare going. Healthcare is going to definitely meet the patient where they are.
Sure.
No longer will this be. It's a book by Eric Topol now called The Patient Will See You Now.
Mm-hmm.
Instead of the other way around, where it's about what did the doctor say. Remember that growing
Sure,
up? It was like, what did the doctor say? What did the doctor say?
yeah.
What did the doctor say?
Yeah.
And now we're really trying to change that paradigm where we make the patient the center of the universe, of our universe, unlike it has been historically.
Sure.
And that is a paradigm shift that's going to take empathy for the well-trained physicians that we have out there, and nurse practitioners and mid-level providers, as well as the nurses, the well-meaning nurses that are seeing these patients in the hospital.
Sure.
They're really sick. We do a really good job to get them well, but then we get a report back to say, oh, I didn't like the sheets. So the healthcare is getting more consumer based,
Sure.
but at the same time, we're going to have to figure out where does it all fit.
When our students are going to be going into organizations where there may legitimately be a 40-year age spread between where they are, and they may be going into a leadership position at a young age. When you're working with physicians, is there a different approach you use in introduction of technology to my geezer group versus the young?
You know what, there is, or there should be. I have seen some companies go pretty, they just want to do what we call big bang. Get them all in, get them live, they'll get over it, sink or swim. But I've also seen some very thoughtful companies who understand. We do, for example, in my past, if we had 180 pediatricians in one area where they were age ranges from 32 to 78. The average age was 58 though. And before I came there, what I learned was that they bought Mavis Beacon Typing Tutor for all the doctors. Typing is a skill you don't learn after a certain period.
Yeah,
I don't know. I was,
Yeah.
And so those are things I realized quickly. Like, I think we may have some other options. Let's first survey them to get their comfort level as far as a computer, keyboard, navigating. Some of these doctors didn't even have computers at home. They would depend on their wives or their kids or their grandkids to do things. They didn't know how to attach an email. They didn't have basic computer literacy. And now we're saying, hey, your livelihood is dependent on this computer.
Sure.
The care of the patients is dependent on this computer. And I didn't feel that was fair. So the next move was to find out what are things that we can use, such as naturally speaking, natural language recognition software.
Sure.
How do we incorporate that so they can just speak the note, what's going on in there, and it comes right on the screen, they can sign it. How do we augment them with, say, a college kid, pre-med student that wants to go into healthcare, let them become a scribe, where now they actually man the computer and the doctor can be a doctor.
Yeah.
So really thinking creatively around these is what we're going to have to do to address the older generation. And now we have what we call the digital natives.
Sure.
They grew up on this stuff.
Sure.
And then we have the Jerrys, the digital immigrants.
Yeah, that's right.
You have the digital immigrants.
The drug into the
you got drug into this place. So,
Speaking of dragging, it appears as you're helping a medical organization collect tremendous amounts of data. And how do you help the senior management group within a big system like this understand the power of data and how to use it?
Jerry, I think that is one of the biggest challenges that I'm seeing in healthcare across the United States is that we've gone from zero data other than what the insurance companies would tell us.
Sure.
This is what your data is, to now we have all of this data that's more robust than the insurance companies or the payers, even the government.
Right.
But I don't believe that is a core competency in healthcare organizations across the United States to understand how do we use the data from everything from the time the patient checked in to the time they were roomed to realize, whoa, there may be opportunity that we can do something. Though it's so much data that we're not there yet. But I think that what you will see is that data will be used in process improvement methodologies such as Lean, Six Sigma, and different things to say, how can we improve our processes and not just financial? Typically the data is all about financial in healthcare organizations. And now it's about quality. How many patients on this unit had a Foley catheter more than 24 hours inserted? Because what we know, if they have it more than 24 hours, the chances for an infection goes up, which is one of the leading causes of, of death sometimes, infection in hospitals. Or how do we use this data to say, this patient, based on these 15 data points, has about a 40% chance to be readmitted within 30 days. How do you use that data to now do predictive analytics? That's really what's hot now. Predictive analytics. Using the data to look at concurrent uses, say how many patients or populations of patients have this or that. Now we manage them in bulk, right? That's one use. But then also using the data to predict what will probably occur with the really high degree of statistical significance is really what you're going to see in the near future. And there's tons of companies out there that are doing it, but I find that currently hospitals, if they really targeted their resource in the right area, they could do it themselves.
Excellent.
And it just, so those are competencies that I feel like the VPs of the future, they're going to be that. You're going to see that emerge very quickly.
It also sounds like it's a tremendous opportunity to really stratify and segment your populations that you serve
exactly
by
right.
ethnicity, by age, by
That's exactly
communities.
right. That's exactly right, Jerry. You dinged it. We now can target better. And you always say everything can't be a priority, right?
Right.
And today's healthcare system is about 18 to 19% of the current gross domestic product. The cost is going up and up and up. And what we know is that there's a small population that is really consuming a large amount of those dollars.
My generation.
Jerry's generation, yes, yes.
We're the takers.
You're the takers,
Right.
yeah. So what we want to do is say, look, let's focus on that population like a laser, and so let's get those heart failure patients, pull them out, get them in a program that can manage them really well,
Right.
so that they're not coming back to our hospitals, so their family's not coming, paying $12 for 1 hour parking in one of our hospitals.
Right.
That's not patient-centric. And so we could have the data, we could do that now, and now creating that and doing it is what we have to do now. And so a lot of very progressive hospital systems are starting to do it, and those are the ones that I think you, me, and our friends and family, we want them there.
Right.
Right? And so I think that's going to be the new differentiator in healthcare 2.x is what I call it.
Well, looking at your career with your physician hat on, and looking at the ability to effectively communicate within your care team when you first started practicing, and now with the addition of technology, do you think it's changed a little bit, or has there been significant change?
I think there's been significant change, Jerry. It's been a sweeping change. There was so much face-to-face interaction that was needed, so much phone call the doctor, and now it's about texting, or it's a message coming across just from outside the door to me to say,
Sure.
hey, this patient is ready, or a little flag that may pop up where the communication sometimes get lost. And I do think that's a cultural thing that we have to really be careful that we don't let this technology replace face-to-face or phone call. If a pharmacist in the past had any inkling that this order that I wrote was if they had any inkling that this order that I wrote was not quite right, they would call me.
Sure.
I'd get up at 2 a.m. and he'd say, hey, Dr. Butler, you ordered vancomycin. I don't know, yesterday you had this dose. I'm like, oh, good call, good pickup, change that. And now with the computer, they get the computer order and it shows that I ordered the same thing. They may see that I checked a box or something that said benefits outweigh risk. So they may say, oh, he saw it. He that could have been just muscle memory that I did
Sure.
that, right? So they may not call. So
Right.
they trust that, and those. So sometimes I've seen those type of errors as well. So I think it's going to be more important now than ever to know when to pick up the phone and call and double check that this was meant to occur and to protect the patient and to preserve our collegiality between physicians and pharmacists, nurses and pharmacists, nurses and physicians.
It's interesting that you're really managing technology to make communication better. So it doesn't replace.
Exactly. I always use an analogy. It's like the iPhone. If I borrowed your iPhone, I couldn't call my mother. I thought that would get you right there.
To make the old guy cough.
Well, the point is that we've now depended so much on technology that I'm looking for her name, or I'll say Siri, call mom.
Right.
And I don't know her number anymore.
Yeah.
Navigating. When I go places, it says Starbucks on the left, and I see my Green Queen on the right. I turn left just for the heck of it. So you get my point.
Well, I think we've done a great job on helping us understand communication challenges and linking technology. In closing out, I'd like to kind of shift to the personal side a little bit, that we're trying to help students understand that through their life, their work life, they're going to have to make many different transitions. And just looking at your background, you made some major transitions. Can you share a little bit about what some of those were and how you managed them?
Yeah, so I'm a small town country boy from Texas, a little small town in Texas, and so I didn't really go vacations and didn't have doctor parents and all of that. So I'm first,
Sure.
so a lot of things that I had to kind of learn on the fly and be pretty versatile and learn how to read a room really quick, to adjust depending on where I was. So I think what I've learned, the things that I've learned as I've adjusted was going from a physician. The biggest change has been going from a physician who really has autonomy to now going into as an executive role. And where in that role, it's really about influence. It's about listening. It's about being empathetic. I always joke sometimes that I'm in meetings sometimes and we all know the right decision we need to make. We know it. Going into the meeting, we know the decision we need to make. If I was in the hospital, I'd write an order for that decision. Here's the decision. That's my. Here you go. Take that order, right? Or I put in an order. CPOE, computer position order entry. But now what you realize that we have to meet. It may go a little slower. You have to build camaraderie, listen to one another's feedback, go around the room, and question it. Candor with respect is really one of those things that I had to really learn, because coming from a physician world where when someone's crashing, Dr. Butler, code blue, room 323, I'm not really cared. I'm not really.
Not
listening.
a democracy.
It's not a democracy. You're pumping on chest, you're cranking up epi, you're doing this defib, defib, and all these things that you just programmed to do. And then when you come into this realm where now you're trying to affect the lives of 3 million versus that one, you now have to really be collaborative and create a team approach, and really learn how to do that. That's something they don't teach in medical school. So I had to really reinvent myself and get coaches or people that I asked to be my mentor. Can you meet with me? Can you show me how you do that? Jerry, I don't know, I'm not good at that. And I had to make people feel open to give me feedback. And that was really tough sometimes, because I'd leave meetings thinking it was great. And of course you get that, like, Dr. Butler, I think you made her cry. Whoa, I think you made him really upset. I was like, but I felt like the meeting went great.
I was happy.
Exactly, because you did all the talking, Dr. Butler. And so those are the things I think, those organizational type skills that I find are crucial. And what I'm learning is that the higher you get up, or quote, the more boxes you get under you, the more you're going to have to seek out those coaches and seek feedback and get someone that can really help you take this to the next level. And throughout all that, that's something. Even my voice from Texas, I would say words, and I may have even said something in this interview. There's words like, and when I had my first practice in Pennsylvania, I always had a patient would stop me and say, "Wait, Dr. Butler, where are you from?" And I was like, So I try to go back a minute in my head and say, what word did I say? And then they'll say, "You said July." I said, how do you say it? I was like, I thought that was how you say it. I said, no, it's July. I'm like, I got it. My point is, they were kind enough to just to say, hey, there's a dialect. No, it's not going to affect their care. But if I choose to communicate better with those type of patients and choose to remove that as a barrier to their care, then
absolutely.
Yeah, so those are the things that, you have to kind of open your mind, and then that's a very conscious decision. Say, well, you know what? You get used to my southern drawl because I'm your doctor. I could have done that. I've had patients, as an African-American person, they say, "Dr. Butler, I don't mind that you're colored." And I'm like, I don't mind. And these are 80-year-old, the greatest generation, World War II, And honestly, it was the spirit of what he said, meaning he was really grateful that I was his doctor. That was a compliment in his mind. And it's like, well, you know what, I really appreciate that. I'm not going to re-raise him in that exam room, right? And that's okay. And so those are the things that I think as you develop and you grow, you're going to have to pick and choose your battles very carefully and thoughtfully, and say, what do you care about, or what do you really want to do with your life? And I think that's the part about reinventing yourself. What worked when I was in college will not work today. I think it's a book, what got you here won't get you there. And I think as more and more of us realize that, the better I think we're gonna be as leaders, and mentoring those below us. I mean, we have people. I've got so many folks that watch me, and I get these emails. Hey, Dr. Butler, we heard this or that. I saw you do this or that. No clue, and I didn't even realize I said that or this. And they're watching, and so I think it's a good thing that. It can be tough, under the scrutiny all the time, but that's the role of a leader, right? You accept that. So.
Well, we're grateful that you took the time to come in and not only share your views on technology, but to do a little bit of coaching and mentoring for us.
No, thanks for having me, Jerry. Yeah, I appreciate it.